If you have numbness and tingling of the thumb, index finger, middle finger, and the inside of the ring finger with sparing of this area of the hand, then you have something called median neuropathy, otherwise known as carpal tunnel syndrome. But if you have numbness of this area as well as all the other areas, then you have something called pronator teres syndrome. Now, both of these are nerve entrapments of the median nerve, and they can both be treated conservatively with things like NSAIDs, but for a more long-term approach, a surgical decompression could be necessary. Now, if you have numbness and tingling of the little finger and the outside of the ring finger with some numbness on the outside of the palm right over here, but sparing on the back, then you have compression of the ulnar nerve at Guillen's canal right over here in the wrist. But if the back of the hand is also numb, then you have compression of the ulnar nerve at the cubital tunnel located in this area of the arm. Now, in a similar fashion, both of these could be treated conservatively with immobilization and NSAIDs and could require a surgical decompression for a more long-term treatment. But if you have numbness of this part of the hand with no motor deficits, then you have a compression of a superficial branch of the radial nerve causing something called Wartenberg syndrome. And the treatment for that would be to remove any sort of compressive material from the arm, and if that doesn't work, then you guessed it, surgical decompression could be necessary. But if you have a hard time extending your wrist backwards just like this, and you have numbness and tingling in the back part of the hand, including the ring finger, middle finger, index finger, and the thumb, then you do have compression of the radial nerve in the middle part of the arm called the radial groove. Now, Saturday night palsy could be treated conservatively with things like physical therapy, and if that doesn't work, then surgical decompression would again be necessary. Now, if you have numbness involving the entire palmar surface of the hand and the back part of the hand, and you also have weakness of the hand, then you might have compression of an area called the brachial plexus. These are the nerves that come out of the neck that come together and go all the way down to the arm to give innervation to the muscles of the hand.